Have you ever found yourself in this dilemma when you're feeling under the weather? Should you push through an exercise to sweat it out? Or should you rest completely? I've been in this exact situation countless times, torn between maintaining my workout routine and wanting to recover quickly. The conflicting advice online only makes this decision more confusing. But recent research findings have completely blown my mind. What scientists have discovered challenges everything we thought we knew about exercise and immunity. A groundbreaking study from Harvard School of Public Health tracked 50,000 people for 8 years, and their results were absolutely shocking. Let's face the reality first. The average working adult catches a cold 3.2 times per year. During these times, most people struggle with the exercise decision. Research shows that 72% of adults make incorrect choices about exercising when ill, often leading to prolonged recovery or worsened symptoms. Here's where it gets fascinating. Immunology researchers at Loughborough University discovered that our immune system responds completely differently to exercise, depending on our current health status and exercise intensity. This explains why people get such conflicting results and advice. The most surprising discovery is what's called the neck check rule, officially recognized by the American College of Sports Medicine. This simple guideline divides symptoms into above the neck and below the neck categories, and the exercise recommendations are completely opposite for each. Above the neck symptoms include runny nose, sneezing, mild sore throat, and headache. Remarkably, light exercise with these symptoms can actually speed up recovery. German Sports University conducted an experiment where people with upper respiratory symptoms did 30 minutes of light aerobic exercise. The exercise group recovered an average of 1.8 days faster than those who rested completely. How is this possible? Light exercise enhances immune cell circulation throughout your body. Improved blood flow allows white blood cells and antibodies to move more efficiently, essentially supercharging your immune response. Studies show that immune cell activity increases by up to 40% after appropriate exercise during mild illness. However, exercise intensity is absolutely crucial here. Even with above-the-neck symptoms, you must reduce your normal intensity to 50 to 70% of your usual level. Going too hard can backfire and actually suppress your immune system when you need it most. Now, below-the-neck symptoms tell a completely different story. Fever, muscle aches, chest congestion, cough, diarrhea, or vomiting are red flags that mean absolutely no exercise. The reason is critical to understand. Below-the-neck symptoms indicate your body is fighting a serious infection. Exercise during this time diverts energy away from your immune response, significantly delaying recovery. Worse yet, exercise stress increases cortisol production, which actively suppresses immune function when you desperately need it working at full capacity. Research from the University of Toronto tracked people who exercised with fever. Their recovery time was extended by an average of 3.4 days, compared to those who rested. Some participants even developed serious complications like viral myocarditis, a potentially dangerous heart inflammation. Here's another crucial factor. Most people overlook the timing of returning to exercise after illness. Starting too early increases relapse risk, while waiting too long leads to rapid fitness loss and motivation decline. Swedish Sports Medicine Institute discovered the golden rule for exercise resumption. Wait 24 hours after symptoms completely disappear before exercising again. Then follow a graduated return: first week at 50% intensity, second week at 70%, third week at 90%, and full intensity by week 4. But the story doesn't end there. The preventive effects of regular exercise on immunity are truly remarkable. Queensland University in Australia followed participants for 12 months and found that regular exercisers had 43% fewer cold episodes. When they did get sick, symptoms were 32% milder and lasted an average of 2.1 days less. This demonstrates exercise's long-term immune benefits. Regular physical activity boosts natural killer cells, specialized immune cells that eliminate virus-infected cells and even cancer cells. People who exercise consistently have NK cell activity that's 60% higher than sedentary individuals. Different types of exercise provide distinct immune benefits. Aerobic exercise primarily enhances cardiovascular health and overall immune circulation. Strength training stimulates muscle-produced myokines, powerful proteins that reduce inflammation throughout your body. Moderate intensity exercise provides optimal immune benefits. Too light has minimal effect, while too intense can actually suppress immunity. The sweet spot is 60 to 70% of maximum heart rate. Performed 3 to 5 times weekly for 30 to 45 minutes. However, there's an important warning about excessive high-intensity exercise. The open window theory describes how intense workouts temporarily weaken immunity for 3 to 72 hours post-exercise. During this vulnerable period, infection risk actually increases. Marathon runners demonstrate this effect dramatically. Research shows their upper respiratory infection rates are 2 to 6 times higher than average for 2 weeks following races. This emphasizes why recovery and nutrition are crucial. After intense training sessions, when you do have mild above-the-neck symptoms, the best exercises include gentle walking, stretching, yoga, and Tai Chi. These activities improve circulation without overwhelming your recovering system. Breathing exercises are particularly effective. Deep, slow breathing activates your parasympathetic nervous system, reducing stress hormones and boosting immune function. Just 3 10-minute breathing sessions daily can increase white blood cell counts by 15%. Hydration becomes even more critical when exercising while mildly ill. Your body needs extra fluids for both immune function and exercise recovery. Choose pure water or warm herbal teas over sports drinks, which can sometimes irritate an already sensitive system. Nutrition plays a supporting role in exercise and immunity. Vitamin C and zinc support immune function, but excessive amounts can actually be harmful. Focus on whole foods and ensure adequate protein intake post-exercise to support both muscle recovery and immune cell production. Sleep cannot be overlooked. When fighting illness, aim for 1 to 2 extra hours of sleep nightly. During sleep, your body produces growth hormone that repairs tissues and strengthens immune defenses. This recovery time is when exercise benefits truly manifest. Individual factors significantly influence how your body responds to exercise during illness. Age, existing health conditions, fitness level, and stress all affect your immune resilience. People over 65 or those with chronic conditions should be especially cautious. Individuals with diabetes, heart disease, or other chronic conditions should consult healthcare providers before exercising when ill. Pregnant women and those taking immunosuppressive medications also need special considerations. The bottom line is clear. Light exercise with above-the-neck symptoms only may help recovery, but any below-the-neck symptoms or fever mean complete rest is essential. Regular moderate exercise provides the best long-term immune protection. Most importantly, listen to your body's signals. If your body is asking for rest, honor that request. Exercise is a tool for health, not a goal that overrides your well-being. Your immune system and quick recovery are what matter most. If this information helped clarify your exercise decisions during illness, please like and subscribe. Share your own experiences in the comments below. I'll be back soon with more valuable health insights. Thank you for watching.